I think we're ready to start. Sorry for the technical issues. Welcome to this School Health Wellbeing Research and Development Skills Seminar. We've got about 30 odd folk joining us online. Hopefully they can hear us. I'm David Blame, with the General Practice. Really pleased to have Jim Caryl, who's the Research Impact Officer for the college here, and to tell us a bit more about how we can make more impact and demonstrate that. Thanks, Jim.
Cool. So, thankfully, I'd only planned on talking for about 40 minutes to leave enough time for discussion, but if people do have burning questions, then do feel free to put your hands up, or we can kind of save it for some discussion afterwards. So I introduce myself a little bit more about what our team does. So it's a relatively small team. So it's myself and Camilla Fiduti, and we're here in the college primarily to help promote and embed increased awareness and understanding and best practice around research impact. We do manage a pipeline of known kind of identified impact opportunities across the college, many of which will form a pool ultimately to feed into the ref, but there's lots of other uses and value that we have for collecting information about the impacts that people are having through a value to the college. We work with ref impact leads across the different schools in the college to identify and develop impact case studies. We're part of a wider team, the Innovation, Engagement and Enterprise IEE team, that has kind of a partnerships team, business development team, and the Translational Research Initiative, the TRI team. So we work closely with them because the TRI team have access to funds that can help support people in realizing kind of translational opportunities or partnership building and things like that. And we also kind of help facilitate training either directly by us or bring in external trainers to support core competencies in research impact. So what we think of as understanding impact, planning for impact, stakeholder mapping and engagement, which is a good part of planning for impact, and evaluating and evidencing outcomes and impact. And it's kind of points. Well, I'm going to cover a lot of those points today, but mainly focusing in on planning and evaluating. And we also work closely with a central research services impact team, who also can support people with impact questions. That is kind of like the umbrella group that brings together all the different impact teams across all the 4 colleges, and we work. In fact, we actually sit in an office with each other, so we know what's happening in all the other colleges as well. And they administer a fund as well, the Glasgow Knowledge Exchange Fund, which again is a useful tool for funding things such as relationship and partnership building or community and public engagement initiatives. It doesn't fund translational research or anything that would be considered research, but certainly lots of other activities.
Well, from IT,
I think we're good now, actually. Yeah, thanks a lot. So just to bring everyone to the room into what we're actually talking about, because it's quite difficult when I don't necessarily know the audiences and people at different career stages and at different points in the research, and there may not be PIs on grants, so they're actually just working on grants. So it's good to kind of be singing to the same hymn sheet. So impact is a demonstrable contribution of a research to a measurable effect on or change or benefit to the economy, society, culture, public policy, services, health, the environment, or quality of life beyond academia. And when we're talking about impact, in terms of the actual things that we're measuring and talking about, we're talking about things like increases or gains in efficiency, effectiveness, well-being, engagement, access, profit, and skills, or reductions or loss in mortality, waste, risk, cost, stress, and harm. So, for many people doing research, these are not necessarily things that they're directly measuring. I mean, some people are, and actually probably in this school more than others, these might be elements that people are actually directly measuring and understanding. But these are the downstream things that we might measure as a result of research reaching an environment where people are able to use. Whenever someone gives a talk about impact, there's usually a slide about why you should care. And quite often it gets very heavily loaded with lots of external drivers, the things that people want you to do. and that, you know, universities feel that they must do, and that's what funders want, and there's lots of demand and challenge-led funding and things. But it's not actually, when I talk to researchers, and I've been doing this for like 12 years now, when I talk to researchers, the people who are really engaged in kind of aligning impact with the research that they're doing is by intrinsic motivation. It's by internal drivers. They get personal satisfaction from that kind of paralleling of the impact prospect or the impact idea with the research that they're undertaking. Some people are just curious about the relevance of their research to society, but for most people, I would say it's just a natural next step. So they reach a point in their research where within their own kind of cohort of researchers within their own discipline, they can't really do anything more without involving perhaps another disciplinarity, another set of researchers. And that's when barriers start to break down and assumptions about use of language, about what concepts people understand by their research start to change just by working with those other disciplines. And that becomes the next step to working with, you know, stakeholders in the community setting to actually understand where the research can go. And what we always try and kind of emphasize is the value that this slightly adjusted thinking can have to your actual research planning. So the idea that by thinking in terms of your kind of impact trajectory, you can start to develop questions and attitudes that make you ask subtly different questions than you might have asked without that kind of engagement, without talking to these external partners. To get curious about your outputs and how those outputs are being used. Quite often the relationships people form can be quite transactional, and you might provide what we would consider the output, the deliverable of your research, but not necessarily know what happened with it or how people are using it. And if you don't know how people are using stuff, then how do you know that it was actually a good fit for them in the first place? Ensure that any plans or interventions and activities are well designed and serve the outcomes that you're aiming towards. And then recognizing that stakeholders can add value. So in terms of capability, capacity, funding, equipment, access, and network. And obviously, a lot of people are not necessarily going to continue in research careers as well. And a lot of the activities involved in reaching out and getting involved in these other kind of community projects and working with partners is good CV for them. It's good experience. And of course, there is the perennial, or annual, in fact, issue of P&DR and promotional criteria. So impact is one of the defined promotional criteria. Some time ago now, it was de-articulated from the ref, so that you didn't need a ref impact case study to get promotion for work around impact. But there is still a requirement to kind of describe, in essence, some degree of capture, some degree of understanding of what your activities have led to. What you tend to get is a lot of activities without any sense that they've actually led to anything. So this is something that, you know, we're trying to have training in place and have, you know, be a referral point to people to ask us questions about how they actually show evidence in this regard. So when planning for impact, whilst it's useful to have kind of like maybe a distance goal vision of what it is, the general category of work that you're trying to contribute to, it's actually often not that practical in terms of your planning, because what you actually want is something a bit more short-term, a bit more medium-term in terms of what is realizable, because the actual landscape, and certainly the impact landscape, and this could also be the research landscape, is far more complicated. And actually, you have to kind of bear that in mind. We used to do a lot of these talks before kind of the research councils removed the requirement for creating a pathways to impact, which they rather shot themselves in the foot about, because they assumed that the community had it all sorted and they knew how to do it, and it was just all going to be integrated into the research, which it hasn't been and it isn't, and EPSRC is actually reintroducing them. But Pathways to Impact used to be a really useful tool and a touch point for us with researchers to really think about what it is that they want to do and what the channels are that they're going to explore. And they're like broad categories of different pathways to impact. But, you know, in any given impact narrative and any story, there'll be multiple of these. And actual RAND did an analysis of the last ref and documented over 8,000 independent and unique pathways to impact. So these are just kind of broad categories. So when we're working with researchers, we tend to set them up with kind of 4 questions, which we sometimes do in a template. Some people a template, and it gives them a structured way of talking about what they're doing. But usually we just go and meet people and ask these questions. So we ask people to identify what it is that's happening or not happening out there that you think that your research process or findings may change. And we say process rather than just findings very specifically, because a lot of people, the impact comes in the whole kind of research. If you think this is the research life cycle, this is where they think the impact happens, that when you get your ultimate findings, maybe not this paper or the next paper or this grant or the next grant, but somewhere down the line, you'll have all these findings and that will create the impact. That's certainly true with some cases, but in actual fact, what we find more often when we start to write about impacts, and we're often actually, we're not talking about impacts, we're talking about outcomes, because that's where we start, you know, some of these conversations as well, is they come from much earlier stages, where they come from, rather than people being interested in your findings, they're interested in how you're getting there. So they're interested in the tools that you might develop, whether those be antibodies or algorithms or software, or they're interested in the networks that you generate, the communities of trust, communities of practice that you develop, or even just qualitative research skills. So even at the start of a project, people are capable of doing, you know, rapid evidence synthesis, which can be really useful for people in partner organizations or in NGO groups to get across what the latest understanding is about a particular complex area. And again, that starts a conversation, starts a relationship that you can build on, and then maybe work with them to tease out what it is that you could actually do together that's of value to both you and to them. And then in stakeholder mapping, the key question is who is interested in your research? And we ask that question for lots of different reasons, because you're interested in how they might influence your ability to achieve impact. So when we think about, and this type of grid stakeholder mapping is one of about 3 or 4 different approaches that people use, and there's good papers and literature about it, using these types of things and grading people onto them. But it's really about, if you're very limited for time, where do you put your effort? You know, because obviously you'd think that people who have the most influence in terms of getting your research or developing the impact where you want it to be, and most interest would be the most obvious examples. But in actual fact, when you get into it, you start to dissolve these different categories, and you start to think, well, what are the relationships between the different stakeholders in this? Because actually, even though this is low influence and low interest, that could be your route to this guy. And so understanding the relationships and also the power balances as well becomes really important. And you can go quite deep on all that kind of analysis. The other thing is really knowing what it is that your research is going to allow these communities to do, because firstly, you need to, well, actually, I'm going to save that for a couple of slides time, but one thing that's really useful is to know who else is doing this with them. So quite a lot of people come to us with, you know, some great ideas of, you know, plowing a furrow into a particular policy angle in an African government. And they do so without necessarily thinking that someone else may have already been doing that there are existing pathways, there are existing routes. And this just creates a burden on these different partner organizations to kind of accommodate, because they do want your help, but they're trying to bend over backwards to kind of get you to work the way that they've now become used to. And so this is really just about understanding how you can work with other people who are already working with these particular stakeholder groups. And very also, you know, important to understand what's not just what it allowed them to do, but what it's going to stop them from being able to do. Because that negative context, that barrier that can happen with research and impact is also really important to understand. And then the questions, and this comes into much more fine tuning, it's the sort of thing we do in much more detailed kind of evidencing workshops, is how do you reach these people? And I'm going to come back to a nice way of thinking about or doing this a bit later on. But again, you always have your University of Glasgow networks as your first port of call, and then your wider research networks. But I'm going to come back to that. Now, I always include a set of slides around kind of logic models and things. I would guess that perhaps you're probably maybe more familiar with them in this school than maybe some other schools. But I think they're really useful just to kind of get people understanding a bit more about what their responsibilities are in terms of deliverables and where it changes into being someone else's responsibility. And so when we look at this, we already see that, so your planned activities, your inputs and activities, this is actually the point at which your impact planning starts, because it's also about your inputs. It's who else you're bringing into the project and what resources and whatnot are involved in the project. So, if you're a postdoc and you maybe arriving to the existing grant, maybe this is a bit more out of your control, but you have control later on about how you talk to people and how you bring people into it. Activities, obviously, the things you do, but that also includes your engagement and communications plans. And then your outputs are your deliverables of your research. So that's fairly clear, but we'll define that a bit more. What outputs look like varies massively depending on your discipline and where you are. So if you're a lab researcher at the bench, your output is going to look wildly different from people whose outputs are clinical trials, because clinical trials will have inherent benefits within them. There will be people or animals or environments that benefit. But the thing is that even in the context of those, doesn't mean that intervention is going to be paid for, is going to be taken into policy, is going to have reimbursement. It doesn't exist. It exists within the context of the research. And when the research stops, it will stop. So it's still just an output. Outcomes are then what people do with the output. So the outcomes are how people engage with this in the real world. And then impact happens downstream of that. And it's obviously not linear. In fact, it's even less cyclical than this. You can put lines in every possible different direction. But what we recognize, where we insert ourselves here is recognizing that there are iterative cycles of this process of producing outputs and maybe recognizing that those outputs need to reach a different audience, or they need refinement in terms of an assay that you've developed, or some form of community practice that you need to kind of delve into. So you need to develop that a bit more. And this is where kind of the translational team and us and our team can help people to think about and focus their activities and identify funding that can help support this activity and also produce better outcomes. But the other point I want to make about with this slide is about what you can control, so your spheres of influence. So you can only really control your outputs, your activities, and what you choose to do in terms of developing those with internal support. The outcomes you can influence, and obviously the act of engagement, and whether you're using an NGO to kind of help promulgate your information to people, or whether you're acting as a bit of a knowledge broker yourself and actually being the person at the coal face talking to these communities or the policymakers. This all kind of dictates your sphere of influence. Now, if you're quite transactional, this is usually, you have very little influence here because you've passed off your output and then you don't really know how people are using it or what people are doing with it. And then the impact itself, you have little or no control over it. So we don't do impact ourselves. Impact happens out there. All we can do is have some sphere of control of the outcomes and hope that they are setting everyone up in the right direction. And then if you want to go really deep, and that's when you start talking about theories of change and having theories of change sessions, because at each of these points, you have to address causal assumptions about whether the outputs that you're producing are actually capable of producing the outcomes that you are wanting. And if that's not the case, then what are the risks of that not happening? And who else do you need to bring in and consult to get a better idea of whether these things are actually going to produce the change that you think they're going to produce? But I'm not turning this into a theories of change session because they also go very deep. It's just in terms of what outputs look like, and this obviously I say varies across the board, but it could be things like a new antibody, a new mouse model, a new algorithm, methodology or workflow, new software, new understanding about a disease treatment, characterizing a patient population or findings for a new health linkage study. These are all outputs. And if you've been actually working with maybe an external group or an NGO on these, you might have other types of outputs. So there's practice manuals and guidelines, policy briefs, health economic analysis, or professional training framework. But they start to look impact. Either this is quite often what people put down as their impacts when they send us information, but they're not. They're outputs. we don't know how they're being used yet. You know, it's how they're used that is actually going to produce the change that you're interested in. And so the outcomes become a bit more about, you know, the adoption of a new technology or professional practice. So that act in the license of patents to industrial partners, a new strategy, policy, or legislation. So even the new policy being formed is still, it's an outcome that hasn't delivered on the reason for the formation of that policy yet. That will be later. Or any new clinical guidelines. There's an expectation that people use clinical guidelines, but it doesn't mean that they will. People use different types of clinical guidelines in different contexts. And then the impacts themselves become much more narrative, which is why there's no real useful bibliometric method for really communicating impact. It's a narrative act, and it's why we use case studies as the formula for, you know, articulating them. So there we have the realized health benefits of a clinical guideline or practice change or a new drug being applied in terms of it could be something quite quantitative, so reduce hospitalization by 20%, you know, numbers. It could be, you know, reimbursement and real world effectiveness of a new drug. So we've got all the clinical efficacy, but the effectiveness is, do people take the drug? And how does that actually work in the real world? Or it's more convoluted. So it's the benefits accrued by users of a product or a service that was sold by a company whom you helped to create, validate, otherwise improve that product or service. Now, these are things that aren't necessarily things that you are going to measure. And actually, many times, that maybe not the things that the people that you're working with are also going to measure either. In fact, it could be other academic groups that become involved in assessing and evaluating these impacts. When you're doing your impact planning, in terms of, you know, your activities are going to look slightly different. So you're going to be looking at, you know, opportunities to do co-design workshops. You might be a secondment, training events, project advisory board, or scientific advisory board. The act of sitting on an advisory board is not in and of itself impact. It's as an esteem marker. It's how you use that opportunity. It's how you use that opportunity to place your own research or other Glasgow University research into the conversation in the room. Obviously, appropriately, you can't just be a mindless shill for your own research if it doesn't actually fit what the need is. And again, the outputs are going to look like a bit like the outputs I showed you in the other slides, so toolkits and reports. So evidencing. So I'd say probably our team spends about 70% of its time doing evidencing work, mainly aligned with the pipeline that we work on, but we also help people access funds to support them with evidencing as well, because we recognize that there can be a bit of a gap that, you know, when you're doing research, you might not have you might not have the scope within it to have an evaluation that gives you the kind of evidence that you need to show that you're addressing the gap that you think you're addressing. And if you've not formed the partners with you who are in a position to do that, then sometimes you need to fill that gap to understand what the evidence is. You know, I've got a slide on that further on that. In terms of what evidence we use all sorts of evidence, anything that we can get that authoritatively substantiates the change or benefit brought about or influenced by the research. So this is just a kind of a pie chart of actual evidence sources we used in the last ref for the college submission. So we draw a lot of information from web pages and statements and testimonials, which I'll mention a bit more about in a bit, financial reports, and go deep into like stuff that people, you know, share with companies share with shareholders and things like that. Research articles, so increasingly the evidence of impacts are often other academic papers around evaluation and other research to really explore the impacts. Guidelines, government policies, regulatory statements, you know, we have to dig into the citations of those to see exactly what research and whether it's your research that they've referred to. Resources that are given to patients or practitioners. Any forms of legal agreements which come back to kind of like demonstrating the relationship between you and the people that you've done the research with or for, and yeah, various data statistics. And in with this, there's probably about 4% of these, so health economic data and maybe stats or surveys that we've actually commissioned within the college to explore evidence for particular case studies that we didn't know the actual impacts were. And when we're talking just as an overview of evidence impact, generally speaking, planning for the outcomes you're pursuing will dictate the change you look for. So you've got to kind of have an idea of what it is that you think you might be changing. I mean, that's useful for the design of research, particularly if you're working with a particular group. So by knowing what will be different, we have, purely for evaluation purposes, we'll know what we'll be able to measure. And we are ultimately quite often with researchers doing a low grade evaluability assessment. Something has stopped. So yeah, considering how you're going to know, again, this is about your evidence planning. But also increasingly, and we're seeing this certainly with more of the kind of implementation research, that big grants are considering answering the impact question as part of the research design. So they're asking, what is the impact of this as a research question? And certainly that, you know, when you're going for kind of impact funding money, if you're on like a £2 or £3 million grant, and you're coming to us to ask the question, what's our impact been, and we need to do an evaluation, they might very well ask the question, why wasn't that encompassed into the multi-million-pound grant in the first place? But, you know, sometimes grants can be quite belt and braces, and they actually achieve quite a lot with a small community, and there was no scope for doing evaluation in the context of the original grant, and that's, you know, a very valid use of that additional funding. Building in ways to follow up with stakeholders and collaborators. So again, we're trying to move away from that transactionality and build sustainable relationships so that you can feel that you can go back to the people that you're working with to understand how they're working with what you've given them, essentially. And I'm going to go into detail in that in just a moment. And then capturing evidence as you go along. So there is a repository. I probably wouldn't use it for everything. I would think about maybe using this in a circumstance where you've produced a definitive report for someone, for a charity, for a policy or something like that, you know, that you feel is a great output. And actually by putting it in here, you can tick a box and have it come through to your staff profile so that other people can see this report as well. But otherwise, we tend to just use things like Evernote, email folders, and folders on your computer. We also, as I mentioned, have these templates that can help people kind of start to map out their kind of impact and structure the different components in that impact journey a bit better. And that just gives you a place to actually, within context, drop into that things that you've done and things that have happened as a result, and cite evidence sources and things, or have ideas for evidence as well. So it gives you just a place, because you're trying to build up a more of a narrative. By understanding the narrative of what you're doing, you start to understand the gaps and the opportunities, and it's usually what comes out of conversations that we have with staff members, that they come to us and it becomes very clear that there's a missing piece of research here, or there's a gap in understanding about how stuff has been used there. Whereas if you just kind of collect things as like a melting pot or kitchen sink of things, you can't spot the pattern or the strand or the things that you should put emphasis into, because you see a lot of activity, but it's not focused. You know, it's not going down the channel that would get you the best outcome for minimum effort. So how do we use evidence, and what are the categories of evidence that we collect? So we're interested in attributional evidence. So we're trying to get this sense of the causal link between the research and the outcome or the impact. We have quite a lot of temporal correlation in research. So there are, you know, large groups of people doing particular types of research, and then maybe a few years later, there's a change. And the two aren't necessarily linked until you've actually done the work to show the linkage. It's also useful I think generally speaking, if anyone's doing work in the international development sector or working with small organizations, fragile organizations or patient groups to collect some kind of evidence of exchange, so that you have done this work, we've passed it over to you, and you have reflected upon this and said this is great, and this will allow us to do this. Doesn't necessarily mean that they've got any impact yet, but it's an acknowledgement of the relationship, because governments change. We've had stuff in Brazil, we've had stuff in several other Latin American countries and Tanzania. Government changes, whoosh, it's like you never existed, and then you have to go back to them and say, well, we have actually just spent the last 15 years working with you on this, and kind of we were making some progress. So actually having a document that says this is where we got to and this is what we've been doing with you is really useful. Reach is just a sense of the different places that your research, that the impact has been felt across organizations and individuals. But more importantly, it's about context. So it's, if the type of research that you were doing was only ever designed within a structure or a facility that exists in Glasgow, then the context of reach is set to Glasgow. And so there's no expectations that it should be affecting people in South America or Africa. So it's about defining, in many respects, when you're thinking about writing impact narratives, it's an exam to which you get to set the questions. So you can define what it was, what the purpose was for your research. And if you reach 98% of the people in Glasgow to whom this was the only place where this is relevant, then you've got good reach. If you reach 90 of the 100 people who have a rare disease, then you've got fantastic reach. If you've done something that actually, when on paper, it looks like it should have been everywhere, and you've only actually reached Glasgow, then that doesn't look quite so good. So again, it's about framing. And then significance is simply the magnitude of the impact. And we use a mix. I mean, this does tend to be a bit more quantitative data and qualitative, but there are elements of those. And then it's really important just to be explicit about the claims that you're making. So, if you think back to grants that people wrote back in the early 2000s, it was all quite like fluffy, and this is what, we managed to do, and there's no possible causal link between, you're claiming too much. I think what we're always trying to do is recognize that there are going to be other contributors, other academic contributors from other universities, and that's completely fine. What we're trying to do is state what your research, how your research has made a material and distinct contribution, without which the impact would not have happened, or would be much diminished, taken longer, happen too quickly, because that can be a bad thing, or cost more. So it's not just about an all or nothing, it's about the quality of that thing. So a policy may have always been due to come into existence, but if you speed it up for good reasons, or if you reduce the costs to implementation of that policy, then even though you didn't create the policy, and even though it's not coming to existence because of you, you've still got a story in how it actually played out. Testimony we use quite a lot. I think, there's often a lot of commentary after the last ref about overuse of testimony, and certainly the kind of the panel A, which is sort of what the college's panel goes to. There was a lot of comment about how whether it could be it can be quite fluffy sometimes, testimony, quite self-congratulatory, and there's quite a lot of expositions of general positivity, hand-wavy positivity. But actually, what we and how we use testimony is really to triangulate different data sources. So we might have some core data. So we might have a bunch of Excel sheets from the NHS, because they love an Excel sheet. I'd like to send you all of them. So you might have this, you might have documentary evidence about the overall program, which those Excel sheets are part of, but you can't link them together easily. So having a piece of testimony that starts to link together the different components is really useful. So they're quite specific and detailed. They help get information that's not in the public record. And again, we can make these kind of confidential, so that they never go into the public record if they're damaging or privileged information from a private company. To disambiguate the benefits. So again, with those giant spreadsheets, we might have like something for all 14 terrestrial health boards in Scotland, but actually we just need the Glasgow GC&C stuff. So actually they can actually, tell us which parts were actually the Glasgow bit that we helped with. And also just to give the backstory, so the actual narrative of how we worked with them. And these aren't the questions that we'd ask, this is what we want to find out, but they're essentially framed just slightly differently. But what we're trying to establish is, have there been any significant benefits arising from the research? How far-reaching are those benefits? To what extent can these benefits be attributed to our research versus other factors? And then I'm trying to understand any forms of negatives or unexpected happenings. Well, because these are things that, again, in another iteration, we can go back around and understand where these are coming from, because that could be a block down the line. And this is really important. Address these things when, if you're working in sensitive areas, you've got people working in, animal slaughter or, genetic modification, even precision medicine to the general public can look like crazy stuff. And if we're not kind of addressing where the barriers are before the actual implementation. So this is just the last slide, but it's also a useful kind of exercise, and it forms the basis of evidence workshops that we're actually planning at the moment. So a really useful tool is the existing ref impact databases, and this is not about training you to write ref impact case studies or that this is like where you should be aiming with your impact, but they are really good case study examples of how people have taken research, who they've worked with, how they've worked with them, and more importantly, what the impacts are that they've claimed and how they've evidenced them and what indicators they've used. Really useful. There's literally tens of thousands of case studies across all of these, across all different disciplinary areas. So a really useful thing to do is to go in and keyword search it against your own research area. You can also break it down by institutions. You can break it down by impact types. You can break it down by the impact location. So if you're working in Malaysia or Tanzania or Ecuador, you can actually look for impacts in those areas and actually start to understand stakeholders that are at play in those environments and who they're working with and how they work and how they collected evidence. And I was just noodling this morning on doing searches against this, alcohol policy. This is the number of case studies in total across the whole thing. And then this is a number of case studies that are just within our panel A. So there's lots of other panels covering, social sciences and arts and humanities and engineering, which also still talk about topics that you might be interested in. So you don't have to just limit it to our panel. But you can see there's a lot of different case studies that you can kind of work through, and it won't necessarily be all of them. Some of them are just like a very slight mention of these search terms. But you can start a map that you can use to develop a kind of an evidence plan for yourself. I'm just going to leave it there.
Thank you very much, Jim.
2 minutes spare.
Yeah. Could open up the floor for any questions. We'll have a look online as well. Yeah.
Thanks. So just about timescale then, it's striking that none of those involves any of the law. Is that because you wouldn't expect it to appear in the 2021 ref year?
Oh no, I've done a search for COVID as well. I think there was about 700 or 800 case studies mentioning COVID in ref 2021. But it was because what people did was that's mentioning of the word, and it's because everyone was asked to kind of put a mitigation statement about how COVID had affected the impact that they were writing about. Not that we were given any form of penalty or whatever for it, but
yeah, I was wondering is what's the, because obviously for like paper outputs, it's like what you've done since the last ref. For impact.
So we can still talk about impacts that were related to papers in the last ref, and then some. I think when we're talking about stuff that we quite often write case studies about case studies that have already happened, and we're looking for what's continued to happen in this new window. There has to be a sense of additionality. Just has to be something more. Sometimes it's just slight creep. Increase of numbers, patients using a particular intervention, something which might not choose to write an entire case study around. But sometimes there's new area. Maybe it's gone from Scotland to international. So we look at those. But yeah, no, we can, I mean, just with the ref head on, in the next ref, we're basically interested in any papers published from 2007 onwards. So it's still quite a lot to choose from.
Thanks, Jim. You mentioned that there's not a necessity to claim everything and to involve colleagues from other institutions.
Yeah.
Does that mean that you and your team work with other similar teams and sort of sorting out the attribution there in terms of working in sort of percentage terms, how much you claim, or?
Yeah, so I mean, strictly with like in a ref kind of project management kind of standpoint, I think the first ref was quite cloak and dagger. No one wanted to show their cards because no one quite knew what was going to happen, and that was quite difficult because I also wrote case studies for the first ref, and so everyone was working in little silos. And then when you saw the case studies come out, you're like, oh my God, what are overlapping over here? And they've claimed what we claimed, or usually somewhere like Oxford or UCL claiming the entire framework within which we delivered our impact. And so they claimed all our impact as well, which just gave grantsmanship. But yeah, we work closely with impact officers and other universities because essentially all we have to do is show the material and distinct contribution that you've made. And then that's kind of like tick. And then all of the impacts associated with everyone's work, everyone gets to claim because we're all part of the story. Sometimes there's bits that very much we can claim a bit more of, but generally speaking, certainly from the panel assessor's standpoint, if you can demonstrate that you've made that material and distinct impact without which it wouldn't have looked the same, then you get to claim all the impact along with everyone else. And yeah, so we do go to and fro to kind of say, well, we did this bit and did the analysis or the evaluation without which we wouldn't have known, and so on and so forth. So yeah, we do work. And the last ref, we actually work very closely. And the other reason for doing that is because evidence hunting, all the universities in the country tapping the same people on the head is a massive burden. And it's a lot, especially if it's like ministerial officers. And so it's far better if 7 universities get together to write a request for a testimony from an MP than all of us independently going by, after the first one's done their thing, then he's just like, no, we're not going to give any more out. That's like, great, well, Sheffield got in there first. No one else is getting anything. So yeah, so we try and be a bit more collegiate like that. There's still some universities that do not like playing like that, and I won't name them, but they do exist, and they will say, oh yeah, we'll do that with you, and then they go and do it. They become the only person that stakeholder will talk to or give evidence to. So that's a bit rubbish, but generally we try to keep good relationships, and we generally get better data, evidence data, because we can also, like we did one with Newcastle around the direct trial, actually. So they had a bunch of evaluation work with actual communities using the intervention, and then we had access to a whole range of other data with private companies using this kind of weight reduction plan, and we're able to join it all together and actually produce a far better kind of evidence data set than you're going to produce it individually.
Any kind of tools to help find sort of policy statement? Things that may. Yeah,
so the most useful tool, and it's one that I've actually been trying to get the university to subscribe to for a bit, is Overton. So Overton was generated by the same guy that created altmetrics, and he got bored of altmetrics because altmetrics is all just about buzz, So altmetrics is good in terms of just going down the rabbit hole and finding directions to go, and it does mention some policy papers, but Overton produces huge amounts of white papers and green papers and all sorts of great literature. You can sign up for a trial and dig into it, but it's really useful, and it's multi-language as well, so you can pull up stuff that people have used in France and various other places to run everything through Translate, but it can be quite useful for that. I kind of feel like the library should driving us to it, because you can put your name in and basically all the policy documents, anything that's mentioned in your research, and it's using AI now to kind of join dots as well, which is quite cool.
Down to that stage policy. It's that, it's another thing, yeah, and we just like in your announcement.
Yeah, so Sage and Altmetrics pull resources.
I was just going to ask, Jim, you mentioned a little bit about plans are in place for next rep. What's on the horizon? We want to say a bit more about.
I mean, we've got college exercises at the moment, which are just around trying to understand what our current pipeline. It's not closed. We always recognize that there could be new, interesting opportunities that happen. You know, it's still 4 years before we kind of need to submit anything. So, and you know, in the last ref, there were things that came up in the last year, and frankly, even 6 months ahead of the submission that we had to jump on because they were like so obviously, and it's just kind of stuff that's spun up really quickly. I mean, if you think how quickly Direct spun up, so that trial kind of went from, you know, the trial in 2018 to basically being everywhere where we needed it to be within 2 years, which is pretty quick. You know, when we first looked at it, we were like, oh, but it's going to have to go through policy and it's going to have to go be implemented and it's going to have to be like all this, and then it all happened. And so that was quite unique, but it don't always work that quickly.
Yeah, I suppose. When do you want to hear from us? Like when's a good time?
Just whenever. I mean, you know, we can't always promise to be immediately responsive to people's requests, and if they're simple requests, then we can get quick answers. And if it's a case of, you know, it's really just trying to understand the opportunities that people have got available to them, and whether actually you would be better off speaking to the kind of one of the funds, you know, to work up a bid for one of the internal funds. And certainly internal funds are not the only source of impact funding as well. There's various little pots of money that come from research councils and charities specifically aimed at exploring impacts, and not just exploring impacts, but actually trying to understand pathways to working with people, you know, what's worked, because what the charities and these funders are interested in is how can we understand practice of policy engagement in Malaysia. And so actually there'll be sort of Newton funds and things to actually fund how we capture that, you know, what's worked and what hasn't worked. And so whilst you can also use it to evidence your own impact, it's also about creating a more general understanding for lots of researchers to understand best practice in those research contexts. So we've leveraged money that way sometimes, and everyone gets a little bit of what they need.
Realist evaluation, sometimes where you're trying to dig for information.
Yeah, so I mean, we always think of like our jobs as kind of investigative reporting or investigative research, and we probably go down rabbit holes that, you know, because a lot of academics that we work with don't necessarily go really deep on understanding the ripples of where all this has gone. It's great if they work really closely with external partners and they get lots of regular conversation about how it's being used, but a lot of the time they vanish into kind of policy holes, or they vanish into, you know, industry users, and you've got to kind of beg, borrow and steal and really stalk them for how they're using this information. Yeah, it's interesting work.
Great, okay, well, there's no questions online, so I just want to thank you once again, Jim. It's really helpful. Apologies everyone for the IT hiccups at the start. Got there again. Good.